Hello and welcome to today's webinar. We're going to title this one New Year's Health Resolutions. So it's the beginning of 2024, it's January, and one of the most common things for people to do, of course, during this time of year is to make resolutions. And it's important for us to kind of talk about New Year's resolutions and to talk about what that actually means. So, but before we get into that, let's go ahead and start with our general disclaimer. So, of course, this presentation is intended for information and educational purposes only. And although I am a licensed physician, I'm not acting in the capacity of a physician for this presentation. And the content provided here should be not construed as medical advice, diagnosis, or treatment. It is simply for your educational benefit. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding medical conditions. Never disregard professional medical advice or delay in seeking it because of something that you have heard or seen in this presentation. And of course, no patient-doctor relationship is being established through this presentation. Even if you are one of my patients that are watching this, you need to have an appointment with me in order to discuss what we're talking about in a clinical environment. Any and all decisions related to medical care should be made in consultation with your licensed medical professional. So a little bit about Wellspring Healthcare. We like to start all of these presentations by reintroducing ourselves. We believe in the power of compassion, effective communication, and empowering education to transform lives. As a trusted provider of healthcare services, we are dedicated to delivering personalized care that nurtures the physical, emotional, and mental well-being of our patients. This can happen in nursing facilities, assisted living, or even in the hospital in certain circumstances. And our experienced team strives to create an environment where compassion thrives, communication flourishes, and education empowers individuals to take control of their health. So we're always happy to try and work with you. And in mind of that, feel free, if you are a resident in one of the congregate care settings that we go to, or even if you're not and you're at another congregate care setting and you would like one of the Wellspring Healthcare professionals to take care of you, please don't hesitate to have the staff reach out to us. We're happy to try and work with you and come to your facility of choice. If you are a facility and you're interested in partnering with us, please reach out to our Chief Operating Officer, Brandy. Her telephone number is 816-708-1658. And of course, all of this information can be found on our website as well at www.wellspringhealthcare.org. All right, and with that, let us jump into New Year's health resolutions. So I wanted to start out by first and foremost defining what a resolution is, because I think this is an important distinction that we need to make. And a resolution is a firm decision to do or not do something. And this is from the Oxford Dictionary. So these are, according to the internet, these are the 10 most common New Year's resolutions. Exercise, lose weight, get organized, learn a new skill or hobby, live life to the fullest, save more money, spend less money, quit smoking, spend more time with family and friends, travel more, and read more. Now, many of these are focused on our health. So exercising more, losing weight, quit smoking, living life to the fullest, I certainly think is devoted towards health. And I would even say if you're going to travel, you have to be in good health to be able to travel. And so that's really an important factor that we have to be considering as well too. So health resolutions are extremely important. But one of the things that happens is that so many people rarely make it until February with their health resolutions. And why is that? Why do they do that? Because they're probably setting unrealistic goals. So if I've never walked more than a mile in my life, and my goal is to run a marathon, that's probably an unrealistic goal. Now, if I'm used to only walking a mile in a day, for instance, would a realistic goal be I'm going to start walking with a concerted effort for 5 minutes, 3 times a day? Now that becomes a realistic goal. And I think the thing that's so challenging about New Year's resolutions is that so often people look at these goals and they say, okay, this has to be something that my end goal, right? So my end goal might be to walk a 5K or to run a marathon or to do a half marathon or a 10K or something of that nature. But it's got to start at a realistic and achievable goal, because if we have this goal that's so far out there for us that we can't grasp it or we can't identify some measurable achievements, then we're not going to be able to hold ourselves accountable to those measurable achievements, and we're not going to become consistent. And so we're going to talk a little bit more about ways in which we can help to set some realistic goals and how we can make them meet those goals as we go along. So the first thing that we need to do is we need to create a plan. So it's great that we've said, I want to lose weight, right? And some people will have said, I want to lose 20 pounds. Well, that's great. I'm happy that you're going to lose 20 pounds. But how are you going to lose 20 pounds? And is 20 pounds our end goal? Is that our starting goal? Is where are we going to be? Because when it comes to weight loss, and we're going to do a whole nother webinar series specifically on weight loss, and I'm really looking forward to that one. But again, we're just talking about goal setting here, right? So to say I want to lose 20 pounds, that's an unrealistic expectation, because how long is it going to take you to lose 20 pounds? It should probably take you somewhere between 15 and 20 weeks to lose 20 pounds. And so that's a very long time. We're talking 5 to 6 months that it's going to take us to lose that kind of weight. And it's going to be very easy for us to get derailed. It's going to be easy for us to not meet certain goals, or to have a pitfall, right? And then we backpedal and we slide, and then we just throw our hands up in the air and say, oh, well, I didn't reach my goal. And so we want to set these achievable plans that we're going to make along the way. So we have to create a comprehensive plan. And this is where it's really important for you to be having this conversation with your doctor, because your doctor can help to ask you questions, because I don't think your doctor is going to probably make this plan for you, right? But we can talk you through the plan. We can ask you questions about what your goal is, and maybe what's a more reasonable goal in the first 2 weeks. And then we're going to talk about how we're going to create that consistency. We're going to talk about how we can create that accountability to help you to reach that goal. Because as a physician, we're often very much like a coach or a cheerleader. We're there to help you along the pathway. We can help you to craft the plan, but you have to execute on the plan. And there might be some starts, there might be some stops, there might be things like life that happens that's going to make that journey not quite as easy or smooth. So what are other things that we can do to try and be as successful as possible? So one of the things that we can do is try to avoid overcommitment. So what is overcommitment? Well, we all know about the person that can't say no. Maybe you're that person. You struggle saying no to someone, and so you get overwhelmed, or you can't do all of these different tasks as well as you could if you focused on one or maybe two of those tasks. And so it's very important to make sure that we're focused on what our goal is. So if our goal is to lose weight, then we want to be focused on our goal. Now maybe you also have a goal of, I want to exercise more. Well, those goals are very synergistic. They're going to help you to be able to reach each goal better, right? So if you exercise more, you are likely to lose weight. But you also have to have good eating habits as well too. So you could have 3 things that are all really melding into one that are maybe leading towards creating a healthier lifestyle, right? Or maybe your goal is to stop smoking, right? Well, if you say my goal is to stop smoking, and I'm going to lose weight, and I'm going to increase exercise, and I'm going to save money, and I'm going to do this, that becomes too many goals for you to be able to actively manage and devote your time and attention to all at one time. So it's something that we really want to kind of pare those back. And again, talking about this with your healthcare provider, they can help to identify which goals are going to be your best goals and which ones are going to be the most important for you in terms of moving forward. So we want to find what motivates you. And I really like this picture here that says, make it a lifestyle. not a duty. Because so often people look at resolutions or they look at these types of goals that we set as work. And yes, it does take work to do that, but this should also be an enjoyable process, because if it's not enjoyable, then we're not going to be successful at it, because we're not going to want to do it. So, if your goal is to start exercising and you decide, well, I normally get up at 6, so I'm going to set the alarm for 4:45 because I want to start exercising at 5 a.m. Well, that's probably an unrealistic goal, and you're probably not going to be very motivated come 4:45 in the morning when you normally get up at 6. So you have to find what motivates you, and you have to fit that motivation into your day. And that's, again, coming back to creating your plan. Now, I put down here measurable outcomes, because this is these check-in points that you're going to be able to use along the way. So if you don't have a reasonable outcome or a way to be able to measure your progress, you're not going to be able to get that motivation that comes back. So again, I talked about weight loss. So if our goal is to lose some weight, right? And your ultimate goal is to lose 20 pounds, I want you to focus on week 1, right? So you're going to have a plan that is going to tell you, we're going to eat a particular way. We're going to try and exercise in a particular way. And our measurable outcome is that we want to lose 1 pound per week. That's it. Something simple like that. And so we're going to measure our weight once a week. Now, if maybe your goal is a little bit more streamlined, where you're like, I want to exercise more. Well, that's great. So you're going to instead choose to maybe walk for 5 minutes 2 times a week for the first week. And then you're going to walk 7 minutes 2 times a week for the second week. And each week you can mark this off on a calendar to see how successful you've been. And that's going to lead into your consistency. But all of these things really hinge on this last word here, which is patience. We have to have patience, because no goal is going to happen overnight. If your goal is to save an extra, $100 a month, because at the end of the year you want to save $1,200, that's going to take you all year in order to do it, because it's not going to be likely possible that you're going to be able to save all $1,200 tomorrow. You can't do that. That just doesn't make sense. So we can't expect that our health goals are going to be any different than any other goal. Or when you were in high school or college, or when I was in medical school. I mean, it took me 4 years to graduate medical school, and then it took me 4 years to graduate residency. I had to have patience in terms of those processes happening, because that was the ultimate goal. All right. So setbacks. Now, I want to be very clear. These are going to happen. And if we can accept from the outset that we are going to trip up, because we are human, for crying out loud, people, it is okay to have a setback. It is okay to not lose our 1 pound per week, or to miss a workout, or to, we slipped up because we had an issue with stress at work. And so we had another cigarette, even though that wasn't our goal, right? We can have setbacks. Now, what's important is that when we have a setback, that it doesn't completely derail us, which is most commonly what happens. So on January 1, someone has decided, I'm going to quit smoking and I'm going cold turkey. I'm doing it. Well, they last 3 days, and then they become irritated, and they're having withdrawals from nicotine, and they feel like they're gaining weight, and they're frustrated. And then their boss says something to them at work, and that causes them added stress. And so now they have a cigarette. Well, if they just say, well, I smoked one, so I might as well just start smoking a pack a day again. Well, that's not good for us either, right? And that doesn't allow us to process what happened, right? Because I think in those types of situations, it helps us to process what happened. So maybe stopping smoking cold turkey and not having any other plan available to you probably wasn't the best idea. Maybe we need to instead talk about using a nicotine replacement. So whether we use a patch or whether we use gum, let's talk about cognitive behavioral therapy, and we enroll ourselves in a program online. Maybe we talk about hypnosis. Maybe we talk about what happened that caused us to really go and use a cigarette. And maybe that was the stress of work. So we look at our work and say, how do I more appropriately and healthily deal with that added stress from work? So again, we're going to have setbacks. Or the person that's trying to exercise more. Maybe they started this walking journey and they started walking 30 minutes a day. Well, now they got plantar fasciitis. Well, it's probably to be expected because they went from a sedentary lifestyle to now they have an overuse injury. Well, that's of course going to happen. And we have to understand that that's a setback, and we have to re-examine our plan. And again, I think this is where it's really important to talk about this with your doctor, to create an individualized plan for you so that then you can use that information in terms of being able to help craft that plan, or when a setback occurs, touch base with that provider again and saying, hey, this happened because of this, and this. And what do you think about changing my plan or doing this? Because I think that we often, as a general rule, will take these resolutions to mean if I mess up at any point in time, the resolution is done. And that's not true. You're making a commitment that you're going to try and do this well. It doesn't mean that you're going to be perfect every time, because you're human. You can't be perfect every time. And the best plans still need to be adjusted and tweaked. All right. So consistency. This comes back to this other process again. So we were just talking about here before setbacks. All right. Setbacks are going to happen. But if we can continually be consistent in our processes, we have the patience to do this, we are not going to become overwhelmed, and we are going to be successful. It takes time. And in many respects, it takes months, if not years, to meet some of the goals that people set for themselves. If someone's significantly overweight, and I speaking from personal experience here, I have gained and lost 80 pounds twice. That is a pretty vulnerable situation that I just shared with the world here. But I have done that twice, and I have had my personal setbacks. And consistency is the key, and it takes patience. And I didn't lose 80 pounds overnight, and I didn't gain it back overnight. But what's important is that I continued to create a plan. I kept enacting that plan, and I kept working that plan, and I asked for help along the way for that. So consistency is the ultimate resource here. Now, we also want to celebrate our successes, because again, when my weight loss journey was to lose 80 pounds, that's great, but you have to build in some small victories, right? Because it took me a long time to lose 80 pounds. And so you have to be able to celebrate these small victories. Now, we want to find a celebration that's consistent with your goal. So if my goal is to lose weight and I've lost 10 pounds, and that's taken me, 5 to 7 weeks to do that, then going out to a big dinner is probably not a goal or a celebration that's consistent with my goal. Instead, I should say, hey, I'm going to get a new pair of pants because my pants are fitting loosely now, right? I'm going to celebrate that small win because it's going to reinforce how I like the way that these pants feel. I've also, in my personal journey, I've celebrated this by having a new exercise goal. Like, I lost 10 pounds. I'm going to ride an extra 10 miles on my bike. Now, that might sound silly, and you might be sitting here thinking, well, how is that celebrating a success? But that is a huge emotional boon for me. And so these successes and these celebrations should be very personal and individualized to you. And this is something that, again, you and your healthcare provider can talk about, or, someone that is very close to you that is going to help you on this health journey that you're going to embark upon. All right, so let's summarize a few things. First and foremost, we want to have realistic goals. Now, if someone wants to say, I want to run a marathon, I love that. I've done one. I think they're great. But again, we want to have a realistic goal. We can't go from a sedentary lifestyle to running a marathon. The same thing is I couldn't go from being 80 pounds overweight to being normal weight within a month. That's not a realistic goal. So we have to make sure that we set realistic goals. We want to have measurable outcomes along the way. We want to be consistent with the plan that we have created. We want to celebrate the small wins. We want to prepare mentally for those setbacks. We want to find what our motivation is, and we want to try and be laser focused on our goal to avoid overcommitment. If you follow these 8 steps, I have no doubt that you are going to be successful at whatever endeavor you have. And I welcome any of your feedbacks because I think that these goals are so exciting. I would love to get an email from someone that says, Dr. Haas, I watched your webinar and I wanted to let you know what my goal was. And I will be that cheerleader along the way for you. I am happy to do that. And I'm happy to help hold you accountable as well. So I look forward to hearing what your plans are. Now, before we go, join us next month for the emotional and psychological aspects of end-of-life care. This is a joint webinar that we're hosting with Ascend Hospice, so we're really excited about that. That will be our 4th in our 12-part series. You can, of course, register at wellspringhealthcare.org, and this is, of course, where we host all of our videos as well, that as well as on our YouTube webpage. So again, keep in touch with us. Please don't hesitate to reach out to William or Brandy or visit us on the website, and you can reach out to me on the website as well. And I look forward to hearing all about your exciting journeys. Thank you so much for joining us.